Now you can simply pause the video and you can try to find out the problem underneath it. So what we can see in this ECG is the first thing that there is apparent bradycardia. So the heart rate looks less than 60. To exactly calculate the heart rate, what we can do is there is simple formula, that is T100 divided by number of large squares. So this is the R wave tip. So this is one large square, this is second large square, this is third, fourth, fifth, sixth and seventh. So there are exactly seven large square. So the heart rate is around 42 to 44. So the heart rate is around 44. So whenever the heart rate is around 40, I always think of complete heart block, because we must know whenever we have a rhythm sinus rhythm means we always tell that the impulses are originating from sinoatrial place in the atrium. So the heart rate will be between 60 to 90. Whenever we have a junctional rhythm, the heart rate will be in between 40 to 60. And whenever it is a ventricular rhythm, it means the ventricle, they are pumping on their own, they have their own rhythm. The heart rate will be around 40 and less than 40. So whenever the heart rate is below 40 or around 40, I always think of complete heart block. So complete heart block, it is very easy to diagnose. The ventricular rate should be completely different or independent of atrial rhythm. That is what is called complete heart block, which is called AV dissociation. It means that there is no relation of atrial rhythm and ventricular rhythm, because in normal scenario each and every P wave is carried out by QRS, means each P is followed by QRS. So there is association between these. That is the reason why in CHB we have AV dissociation, means atria has no relation with ventricle. Atria keep on pumping at their own pace and ventricle keep on pumping their own rate. So how do we come to know the AV dissociation? It's very simple. There is no relation of atria and ventricle. So see here. So this is P wave, this is P wave, and this is QRS. The distance looks around two small boxes. Okay. Now we'll see other where we can find out the P and QRS. Here it is like 1 2 3 4 5 6, around 6 small boxes. Here around two small boxes, here around two small boxes. Here it looks like around 5 bucks, 1 2 3 4 5. It is 5 small boxes. Here around two small boxes. Here around 5 6 7 small boxes. Here is 1 2 3 4 5 6, around 6. So here around 3. Here if you see here, the P is almost touched QRS, so there is hardly one box. Here it is around 5 and 6 small boxes. Here it is around 3 small boxes. Here the P and QRS, there is no, they are almost they are sticking to each other. Here there is so much of, there's 5 and 4 9 small boxes. So basically there are so many P waves. See, this is the P wave, there is no QRS. This is the P, there is no QRS. So there are so many P waves which has no QRS complexes, and this PQRS PQRS distance is totally varying. So to call it as Mobit's second heart block, there should be gradual PR prolongation and then there should be drop. Now what we are seeing here, that there is hardly two small boxes, there is no prolongation at all and the QRS is dropped. So there has to be gradual prolongation, there only there should be a drop to call it as Mobitz 2 heart block. In Mobitz we have Mobitz 1 and Mobitz 2. In Mobitz 1 there should be a gradual prolongation, whereas in Mobitz 2 the PR is fixed. So the PR is definitely not fixed, so it is not Mobitz 2 at all. In Mobitz 1 we have a gradual prolongation of PR. Here there is no gradual prolongation, there is sudden drop in QRS. Like here also there is sudden drop. He see this is also the PR is hardly 2 to 3 millimeter, and there is direct drop of QRS. The QRS is not at all there. See here, there are only two small boxes and the QRS is directly dropped. What it tells us ki the atria, they are doing their own work. They are simply producing so many P waves. They are producing P wave at their routine timing. They are exactly coming after a particular time. Just see, this is one large box, 2, 3, 4, exactly 4 box. Here 1, 2, 3 and 4. So they are, the P waves are repeating exactly after 4 boxes. 1, 2, 3 and around 4. So 1, 2, 3 and around 4. So P waves are exactly at a particular interval they are coming, but our QRS complexes, they are getting dropped. It means कि there is no connection between sinus wave and ventricular contraction. The ventricular rate is around 40. It means कि QRS is not being followed by P waves. P waves are not followed by QRS complexes. It means कि there is a atrioventricular dissociation, which is a feature of complete heart block with heart rate of around 40. So this is a very typical ECG of complete heart block with atrioventricular dissociation. Thank you.